Thank you so much, Patty. So I want you all to imagine a different kind of world for yourselves. Imagine a world where you come to the doctor and you're concerned about a problem, and the doctor can assure you and say, based on your genetic background, based on the fact that you're female, based on your age and all of your environmental factors, we know exactly what medicine is going to be able to help you, or we know exactly what treatment is going to be most impactful and will improve outcome for you. This notion of providing the right treatment for the right patient every single time it's a bit of a different concept. Physicians will tell you, well, that's what I do every day. But physicians will also tell you, well, chemotherapy, we're not quite sure what the cocktail is going to be that's going to be right for you. And instead of having to learn and to figure out what's going to work best for you on a trial-by-trial basis, wouldn't it be wonderful to know on the front end that this is going to be the best treatment for you? When we think about precision health, we're thinking about how we can integrate genetics and use that as a tool and add that to the physician's toolbox in addition to your labs, in addition to your family history, in addition to information about where you live, what you eat, and how much exercise you might get. So while genetics can predict risk, the likelihood that you might be at risk for a particular disease, or the likelihood that you might respond better to drug A versus drug B, it would be really wonderful to include that data point. And the day has come because, as Dr. Gantz said earlier, it's technology, and it's all about time. Excuse me. It's all about timing. And in this world of big data, we can start imagining a very different world for ourselves with respect to our healthcare. Excuse me. The way I like to think about it is it's healthcare more tailored to you. Lots of people will say, well, we're all really almost genetically identical. It's that 0.1 to maybe 0.5% of genetic variation among us that makes us different. So we're pretty much the same, genetically speaking. But when we think about what those unique differences are that actually we can leverage to make better healthcare decisions, it's our genes, it's our lifestyles, it's the food we eat, where we live, how we live our lives. This information, when aggregated en masse across a lot of different people, is what can help us start to think through and predict what medical conditions you might be most susceptible to, what treatments might work best for you. These are the kinds of things that are possible now. Now, you see down here in this slide, and I don't even know if I have a pointer on here, but those of us that wear glasses, we just want to just wear anyone's glasses. I mean, we can go down to Rite Aid and pick up the cheaters because we're around that age where it might be a little harder to see. But we really want eyeglasses that are tailored to our vision with a certain level of precision. So when we think about that, it starts becoming a little clearer what this nebulous term of precision medicine or precision health might actually mean. Now, genes aren't everything. Genetics won't tell you everything. So when we're talking about, we chose here at UCLA to talk about precision health instead of precision medicine, because it's not just the genetics, it's all of these other things. We want information, more information about you than just about disease, because that's going to help us hone our algorithms and help us make better predictions. We're in this world, we're calling it a big data revolution. And a lot of people like to interpret, when they ask me at a very, very basic level, what is precision medicine to you? Well, it's the intersection of genomic medicine and bioinformatics. We're trying to gather a lot of information on a lot of people so we can do what Amazon does when they make their recommender engines, or we can do what Facebook does when they're trolling around telling you what things you might like to do. Well, we want to understand by looking at patterns in the data across a lot of different people. That's how we're going to perfect our algorithms and start being able to make more precise predictions. What can this genetic information actually do? Well, it can help determine the best responses to treatment. It's really unfortunate that most drugs prescribed in the US are effective in less than 60% of patients. So it would be really good to know if all of these people have the same disease, that number one is going to respond to a normal dose. Number three might require a double hit. You have to reduce it for number two. They can all come out, feel better in the end, and have the most effective treatments if we're starting to approach people this way. That's the tailoring piece. That's what we hope genetics can bring to the table. Likewise, we can think about this in terms of therapies. If all of these people have the same diseases, each one of them might require a different form of therapy. And that's based on our individual differences. I respond best to Advil. Other people respond better to Aleve. And it's not just in your head. That's very real. So understanding the genetic drivers that cause disease is very important. So it doesn't matter whether you have breast cancer or lung cancer or colon cancer or pancreatic cancer, for example. If we look at patients with tumors that share the same genetic abnormality, what we can start to do is they'll receive the drug that targets that abnormality regardless of tumor type. So we're starting to think more broadly about that's how we're individualizing care. Breast cancer, is that a good, and I'm interested from the economic perspective, is that a good cause for precision health? 45, women are just said, okay, it's time for your mammograms to begin. Well, what if you're in your early 20s and you really are at increased risk? You have increased familial risk for breast cancer. Why wait till 45? So we know that even though the practice is to screen women once they reach 45, what do we know about breast cancer? We know 20% can be traced to genetic and other risk factors. We know that women with dense breast tissue have a 4 to 6 times greater risk of developing breast cancer and all sorts of associated factors. So by collecting data on younger women, can that inform us? And can that help to start fine-tuning some of our screening protocols? Now, if we screened everyone when they were 20, as a health system, we'd be bankrupt. And it would be stupid. It would be bad medicine. But we have to start thinking about, instead of this one-size-fits-all, how can we make things tailored to you? Here at UCLA, the leadership of the School of Medicine and the hospital decided that we wanted to invest heavily in developing a formal institute. To me, what's exciting about this is that this is truly the most collaborative program we have on campus, because you can't do this without engineers who are mining the data, clinicians who are seeing the patients and can actually bring them to the table, engaging our community. Digital innovation, as Dr. Gantz was saying earlier, we want to be able to do some remote monitoring of patients while they're wearing a watch or while they have something on an app on their phone, and make sure that that gets back to a clinician in a way that makes sense. Our institute is really about creating a home. There are lots of people that are engaged in precision health activities across our campus, and they're doing very innovative work. And what we want to do is create a home for that. We want to facilitate collaboration as far as discovery and innovation. That is very important to us. We're building some key infrastructure to be able to support this endeavor. We're also developing a professional master's program in genetic counseling, which, as we've moved the ball down the court, but still that's another incredible component, being able to have counselors to help explain genetic information to patients, and looking at providing a hub for social policy and ethical discussions. So that is one of the hallmarks of precision health. What happens, patients, many of them don't want results returned to them. We have to wrestle with that. There are academic industry partnerships. Are you going to sell my data to a company? That's another big issue. Authentic inclusion of underrepresented minorities. We talk about it, but do we know how to do it and engage them authentically? So in this way, we want to make sure that we can create a framework to do these kinds of things on campus and then more broadly across California. And in this way, we're creating a learning healthcare system. This is our signature project right now. It's an infrastructure building project. We've developed a universal consent, a way to train, a way to recruit rather, as all patients across the health system. Our goal is to get to 150,000 patients. We've consented over 5,000 patients so far. And there's the recruitment and then creating these centralized mechanisms for us to be able to do this in a coordinated fashion. But at the end of the day, we're trying to create an environment where our engineers and computer scientists can look at this de-identified information and start looking for patterns, machine learning and novel analytic techniques so that we can get to the end game. Because the end game is what I call a new revolution in healthcare. Trying to move away from medicine today, which is this one-size-fits-all, and moving towards a more predictive, a more preventative, and patient-centric model of care than we have now. Thank you very much.